Next, let's take a look at nutrition assessment. First, look whether there is weight change or not, because weight change may be masked by fluid changes. Next, assess for possible biochemical abnormality. Increase in the serum creatinine value of higher than 0.3 mg per deciliter in 48 hours, or increase 1.5 times baseline within the prior 7 days indicate poor creatinine clearance by the kidneys. Blood urea nitrogen to creatinine ratio provides more accurate information on renal function and its likely underlying cause. The increased level indicate dehydration. Hypotension and hypovolemia are the two most common reasons for decreased renal perfusion in the postoperative patient, and lower perfusion pressures might result in decreased urine production. The majority of people with mild to moderate acute renal damage have no symptoms and are diagnosed by laboratory tests. Meanwhile, patients with severe cases may have symptoms such as listlessness, disorientation, weariness, anorexia, nausea, vomiting, weight gain, or edema. 3 common nutrition diagnoses in acute kidney injury include elevated serum creatinine related to kidney dysfunction as evidenced by low urine volume, excessive protein intake related to kidney dysfunction as evidenced by abnormal glomerular filtration rate, and altered serum creatinine values related to renal dysfunction as evidenced by abnormal blood urea nitrogen. For the nutrition intervention, the objectives are to maintain good nutritional status in preventing malnutrition by giving adequate protein and energy, and ensure sufficient vitamins and minerals. To correct and maintain the electrolyte, acid-base, and mineral homeostasis. To minimize secondary organ damage from the consequences of acute kidney infection. Few strategies could be done to achieve the objective are, appropriately limited the quantity of fluids, amino acids, and minerals. Limit intake of fat, quit smoking, and reach or maintain a normal body weight to decrease cardiovascular risks. Fluid overload and hyponatremia should be avoided, and sufficient calories and nitrogen should be given with minimal amounts of water. Lastly, high biological value protein may be given in adequate amounts. First, conduct anthropometric assessment, such as weight, height, and body composition, to ensure the BMI is normal. Monitor and assess whether the biochemical values are at normal range. Monitor the client's food intake. Lastly, evaluate the fluid intake of the client.